healthcare used to be a source of national pride for very high-income countries. But today, healthcare is one of their biggest concerns. The reason is the rapid rise in healthcare costs. If you look at this chart, where the healthcare spending per person is plotted against time for members of the Organization of Economically Developed Countries, you can see that in almost all cases, the healthcare costs have risen dramatically. What does it mean? It means that whoever pays for healthcare, let it be individual patients who pay for their own healthcare, let it be insurance companies who pay for the healthcare of their clients, or let it be businesses that pay for the healthcare of their employees, or let it be the governments that pay for the healthcare of their citizens. It doesn't matter whoever pays for healthcare is facing a heavy economic burden. Let us take the example of the US federal government. In 1966, roughly 1% of the entire US federal budget was spent on healthcare. Today, about a quarter of the entire federal budget is spent on healthcare, leaving only 3/4 for everything else. As you may well agree, this rapid rise in healthcare spending is not sustainable over longer periods of time. So something needs to be done about it. The healthcare ministers that I talk to have the following dilemma. They're worried about how am I going to balance the quality of healthcare and the cost of the healthcare. In other words, they are thinking, how do I continue to provide good quality healthcare to my citizens without bankrupting the nation? Now, the fundamental assumption behind this dilemma is that healthcare systems work something like this. We expect that a lot of money is being poured into the healthcare system, money for paying doctors and pharmacists and nurses, money for the real estate for the hospital, for the pharmaceutical, for the diagnostic equipment. And once we put in all these resources, it somehow works together to provide quality healthcare. And quality healthcare leads to a lower disease burden in the society. Now, this is a very testable hypothesis. Why? Because we know precisely how much we spend on healthcare, and we can measure the disease burden using a metric called as DALYs, or Disability Adjusted Life Years. So, as we measure the wealth of a society using GDPs, we can also measure the health of a society using DALYs. So let me take a moment to explain what DALYs are. DALYs capture two things. First, it captures the years of life lost due to premature mortality. For example, if the life expectancy is 70 years, and if a person dies at 60, 10 years is lost. DALY captures that. But DALY also captures diseases and the burden it imposes on people. For example, if a patient has a broken arm, if a patient has a depression or cancer or heart disease, a DALY is captured depending on how long that person suffers from disease, and also depending on what is the severity of the disease. For example, mild depression has a different DALY than a severe depression. Lung cancer, depending on the stages, has 4 different types of DALY. So this is a fairly accurate way of capturing the disease burden of the society. Now, if we go back to our original assumption of putting a lot of resources leading to quality healthcare, which leads to a lower disease burden, what would you expect? We would expect that the more a society spends on the healthcare, the lower would be the disease burden, right? So let us look if that is true. So this is the x-axis, the total healthcare expenditure per person, and in the y-axis you see the disease burden in DALYs. We would have expected that the more a country spends, the less would be the disease burden, but in the reality, the opposite is seen. The more a country spends, on an average, the disease burden increases, not decreases. Now, when we show this data, people often say, oh, this is not a really comparable data. United States has a separate set of issues. In Scandinavian countries, because of the low sunlight and the cold weather, there are mood disorders and people have high disease burden because of that. So that is why the research commissioned by Dr. Daniel Vasella looked into the relationship between disease burden and spending by disease condition. So this is what they did. So here you can see 4 countries: United States, Germany, Switzerland, and the United Kingdom. And on the top you can see the disease burden DALYs for diabetes mellitus, and in the bottom you will see the healthcare spending per person for diabetes mellitus, and you can see United spends the most per person for management of diabetes. However, United States also have the highest disease burden. On the other hand, United Kingdom has the lowest disease burden, and they apparently spend the least amount of money for managing diabetes, which challenges our assumption that good healthcare costs more. This is a very good example that shows that the good healthcare costs less, not more. So what we did is we took a ratio of this called as a healthcare productivity, and you can see that United Kingdom is roughly 5-fold more productive than the United States in the management of diabetes. So we did the same analogy for other diseases too, and this is what we found. The first example is what you heard. In the case of hypertension or high blood pressure, we see that Canada is a world leader in managing that disease. In the case of COPD or chronic obstructive pulmonary disease, we see that France is the world leader in managing that disease. In the case of acute stroke, we see that Switzerland is a world leader in managing that disease, and in the case of breast cancer, it is the United States that's the world leader in managing the disease. Despite a lot of discussions on which healthcare system is the best, and a lot of emotional discussions about it, what we see is that no healthcare system is best in everything. It really depends on the disease and how that healthcare system used their setup to manage that disease. I want to zoom in on the example of COPD so that you can understand what this really means. Let us take the case of United States and France. France is the world leader in managing COPD, and United States is the laggard. You can see that the smoking rates in the adult population, French smoke more than the Americans. That's a reality. Consequently, there is a higher rate of COPD in the French population than in the American population. Why? Because COPD is driven by smoking. Smoking is the biggest risk factor for chronic obstructive pulmonary disease. Now, what would one expect on the disease burden? Would France have more disease burden in the society or the United States? Normally, one would expect that if there are more people suffering from that disease, there will be more disease burden in the France. But the reality, what we see is that France has a much lower disease burden than the United States. So now one would think, how does France manage that? Does France spend a lot more money than the United States, giving the best treatments and the therapy, and manage to have the lower disease burden? In reality, what we see that the healthcare cost for France is much lower per person. So France has more patients, but they have a lower disease burden, and that too by spending much lower than the other countries. So how do France manage it? France does two things very well. First is, you need something called a spirometry to diagnose this disease. COPD is often confused with asthma, and to have a differential diagnosis of asthma and COPD, you need to have spirometry to do that differential diagnosis. And once you do the differential diagnosis, you can give specific tailor-made treatment for COPD, because asthma medications do not work well for COPD. That is the first thing that France do well: early diagnosis and appropriate treatment. Second is flu vaccine. You can see that France gives flu vaccine to a much higher percentage of COPD patients than the United States. Why is that important? It is important because when the COPD patient gets flu or influenza, they end up in the emergency room. So if you really think about what is happening, France has a lower emergency room admissions. And the nutshell of all this is, although France is more patient, because they diagnose early and they do the appropriate treatments, they delay the progression from the mild COPD to the severe COPD. While in the United States, although there are less patients, the patients progress to the severe stages very quickly, adding to more disease burden and more healthcare cost. So if you go back to this fundamental dilemma, the dilemma that I initially mentioned is not a reality. It is a myth. It is one of the biggest myths in the healthcare, that the better quality healthcare costs more. Often, not in all cases, but often what we see is that the good quality healthcare coexists with lower costs. and bad quality healthcare coexist with higher costs. Why? If you are not providing appropriate prevention, early diagnosis and treatment, the patient progresses to very severe stage, and then the society has to take care of that person, which is more expensive. So, when we did this research, the biggest insight I had is the following. Although the practice of medicines is supposed to be very scientific and very fact-based, in reality, what we see is that it is very cultural. The very same patient with the very same disease, depending on which country he or she is, gets treated or managed differently. To use the metric of healthcare productivity in a systematic manner for every disease, and to understand which is the country that is most productive in managing a disease. And once we understand that, we need to understand why are they good. Like the case of spirometry and flu vaccine in France, why is certain countries better at managing a disease? And if we understand these two things, then we need to do three more things. That is to copy what the leaders do, to copy what the leaders do, and to copy what the leaders do. Thank you very much.